Good morning, Mr. Guthrie. How are you today?
Doing good.
Good. My name is Mimi. I'm going to be your nurse today. Can I get your name and date of birth, please?
Grant Guthrie, 07-2305.
Perfect. Now today, I'm going to hand sanitize real quick, and then I'm going to put my gloves on. And today we're actually going to be doing a head-to-toe assessment on you. Is that okay?
Yes, ma'am. That is good.
All right. You want to go ahead and sit up for me and face down here? Perfect. So we are going to start with, do you know what today's date is?
February 15th, 2024.
Perfect. And you know where you're at right now?
Mimi's apartment.
Okay. What's your full name?
Christopher Grant Guthrie.
All right. And what are you doing at Mimi's apartment?
Head-to-toe assessment.
Perfect. So A&O times 4. Patient is alert and oriented times 4. So the next thing I'm going to do is I'm just going to assess the skin of the head, and it looks like it is intact. No issues or lesions noted. Okay. And if you'll just hold your head up and sit up straight for me. We're going to assess the temporal pulses. Perfect. Those are 2+ bilaterally, strong and equal. Okay. Then I'm just going to listen to do your carotid pulse. We're not going to do these at the same time because the patient could pass out. Okay. Equal and bilateral, strong 2+. So now, if you don't mind, I'm going to assess your eyes. Okay. I'm going to check for your pupil size, and it looks like you're about a 4 on both pupils, 4 millimeters bilaterally on your. Now we're going to check for the consensual response. So what I'm going to have you do is look straight ahead for me. And what this does is I'm going to shine a light into your right eye, and the other eye, the opposite eye, should constrict, okay? Same thing here. This eye should. All right, so now I'm going to have you stare straight ahead for me, okay? For about 30 seconds, and the eyes, you'll notice that they're going to dilate. And I'm going to have this object right here. You look at this. If you notice that the eyes constrict when he focuses on this. Now we're going to do convergence. Just follow this pen light to your face. Good. That's intact. All right, so pupils are equal, round, reactive to light, and they do accommodate. Now we're going to do the skin turner. We're going to check it here at the clavicle bone, and we're just assessing, tickle, tickle. We're just going to assess that it recoils immediately, so that tells us if the patient is dehydrated or not.
My other nurses did it on my hand. Why can't I do it on my hand?
Okay, so how old are you, Mr. Grant?
18. 68. I'm 68.
Okay, so you're 68. So in the older population, they lose elasticity of their skin. So that means that your skin is automatically not going to recoil fast anyway. So then we would be concerned that you're dehydrated. But in fact, it's just a normal aging thing. So this is a more accurate way to assess your recoil of your skin to see if you're dehydrated. Mm-hmm. Okay, if you don't mind, I'm going to get you to lay down, okay? And we're going to listen to your heart and lung sounds. Thank you so much. I appreciate it. So first I'm going to do, so we have this really cool mnemonic device. Remember this. All pigs eat too much. Do you eat a lot, Mr. Guthrie?
Yes.
Aortic, pulmonic, herbs, tricuspid, and mitral. Those are the 5 places that I'm going to listen to of your heart, okay? You just breathe normally. It looks like your respirations are good. You're not using any accessory muscles, so we don't have to worry about your respirations. But I am going to listen with my diaphragm of my stethoscope and the bell of my stethoscope so I can hear your heart sounds, okay?
Yep.
Just breathe normally. I'm listening for loved up. I'm not going to listen to the full pulse right here. Got a fast heart rate, Mr. Guthrie. Are you nervous?
No, ma'am.
Are you sure?
Just naturally fast.
Perfect. Now I'm going to listen with my bell. Perfect. All right, so now I'm going to listen to your lung sounds, okay? So I need you to breathe in and out for me, okay?
Yes, ma'am.
Take a deep breath. Perfect. Let me know if you start feeling dizzy, okay?
Yes, ma'am.
Now I'm going to follow the curvature of the rib down. And the same on this side. Perfect. And I heard no adventitious breath sound. So if you don't mind, I'm going to have you sit up and I'm going to listen to the back of you, okay?
Yes,
so
ma'am.
this is where you're also going to breathe in and out. Okay. Okay. Just breathe in. deep breaths. Perfect. Sounds great. Now, if you don't mind, just lay back down for me. And I'm going to listen to your bowel sound today, okay?
Yes, ma'am.
So the first thing I'm going to do is just inspect the abdomen.
Okay.
That if I palpate before I auscultate, then we're going to hear some noises that maybe weren't there the first time. So we're going to inspect, and we're going to divide this into 4 quadrants, your belly. So we're going to start with your right lower, and we're going to follow the direction of the colon, okay? So the first thing I'm doing, I'm inspecting, and it doesn't look like there's anything going on. I'm not seeing any like hyper movements or anything. Okay, so now I'm going to auscultate, starting in the right lower quadrant. Ooh, when's the last time you had something to eat, Mr. Guthrie?
I'm about to say I haven't ate yet today.
Well, it's active. Awesome. Okay, and now I'm going to palpate. Are you ticklish?
Yes, ma'am.
Okay. Next, I'm going to percuss the abdomen, starting in the right lower quadrant. Okay. And now I'm going to take the pinky of my finger and the thumb, and this is how I'm going to find the bladder. Okay, so I'm going to palpate your bladder. Perfect. Okay, so it is your abdomen is non-distended. Your bladder's non-distended. It wasn't tender at all. No.
Ma'am.
All right. So your bowel sound sounded totally normal, not hypoactive, not hyperactive.
No.
So when's the last time you had a bowel movement?
Earlier today.
Okay. What time? Do you remember?
9:20.
All right. How was that bowel movement? Was it normal?
Brown and hard.
Okay. When's the last time you urinated or peed?
Whenever I had my bowel movement.
All right. Was it normal?
Yes, ma'am.
Okay. What color?
Yellow.
Did it have any did you have any burning, itching, pain when urinating?
No, ma'am. Everything's good.
No odor?
No, ma'am.
All right, perfect. Just relax your arms. So the next thing I'm gonna do, I'm just gonna palpate for these, or first I'm gonna assess for the skin, and the skin does look normal and appropriate for the ethnicity of the patient. So then we're going to palpate the brachial on each side. That way I can, perfect. They're just equal bilaterally, 2+, which is normal, not bounding or anything. Let's do that other one, please. Perfect. Now I'm gonna check your nails. So we're checking here for cap refill. So we're gonna hold the nail bed down, and then if it fills in less than 3 seconds, we know that the patient's circulation is well, and there's no clubbing or cyanosis of the nails. We're gonna check the mouth and the skin around the mouth to see if there's any cyanosis, which is bluish coloring of your lips and all that. That shows that you're not getting enough oxygen, and it does appear that you are getting enough oxygen. Okay, so next we're going to do the hand grip. So I'm gonna have you squeeze my 2 fingers. Okay, perfect. I'm gonna do the same thing for the legs. So I'm gonna have you push down like you're pushing the gas pedal. Good, and pull up. Okay, and now I'm gonna palpate your popliteal. So if you just wanna bend both knees for me. Perfect. Okay, I'm gonna do the same thing over here. Okay, and those pulses are equal bilateral, 2+. Okay, so now we're gonna check for the dorsalis pedis pulse. So the way that you find that is you take the big toe and the second toe, you draw an imaginary line and go in the middle, and you can feel that right there. Okay, same thing here. Perfect. Everything looks like you're doing well. How are you feeling, Mr. Guthrie? Are you in any pain at all?
No, ma'am.
No? All right. Well, you let me know if you need anything, and thank you for your cooperation.
Yes, ma'am.
Thank you.